Deputy President Paul Mashatile is answering oral questions in the National Assembly. Let's take you live to that right now.
Structural constraints in our ailing local government system. The deteriorating levels of municipal performance have emerged as a significant constraint to growth and investments. As a result, several municipalities are affected by weak or unstable governance, poor revenue collection, and funding shortfalls. To address these challenges, in September 2024, the Cabinet resolved to establish an interministerial committee on municipal performance turnaround plan, chaired by the Minister of COGTA. The MPTP aims to address local government underperformance by addressing governance, service delivery, budget, revenue management, and mandatory financial recovery plan. The Interministerial Committee on MPTP will further prioritize interventions focusing on 10 municipalities deemed most distressed by the presidency. This includes Inok Mgijima, Malutia Phofung, Mafube Kopanong, Emfuleni Umzinyathi, Tabazimbi, Tembelihle Ditsobotla, and Mamusa local municipalities. Already, 8 of the 10 identified municipalities have held meetings with the technical IMC and are currently developing their own turnaround strategies. Madam Speaker, yesterday, the 7th of May this year, President Cyril Ramaphosa officially launched Phase 2 of Operation Vula, or Vulindlela, rather. Phase 2 will expect its second wave with more structural reforms in electricity, freight logistics, telecoms, water, and skills to enhance economic growth over the next 5 years. Phase 2 of Operation Vulindlela will target 3 major reforms in the local government sector. 2 of these, the review of the 1998 White Paper on local government and the review of local government funding model, aim to fix deep-rooted problems in the sector and will apply to all municipalities. To this effect, COGTA has published a discussion document on the 10th of April this year, aiming to initiate public debate on a revised white paper on local government, expected to be published on March 2026 after publication. With regard to the review of local government funding framework, National Treasury has completed a review of local government conditional grants, and this process will be implemented in various stages. The third reform will specifically target the 8 metropolitan municipalities, that's the city of Tshwane, Johannesburg, Ekurhuleni, Cape Town, eThekwini, Buffalo City, Mangaung, and Nelson Mandela Bay. This reform is referred to as the Metro Trading Services Program, MTSP. The program will incentivize and support a turnaround in the financial, technical, and corporate performance of these trading services through institutional reform and increased investment for improved service outcomes. The implementation of the MTSP will be effective from the 1st of July this year. In addition to these reforms, the President has launched 2 district development model support mechanisms to address declining service delivery in eThekwini and Johannesburg, in the short term. These mechanisms are known as the Presidential eThekwini Working Group and the Presidential Johannesburg Working Group. In conclusion, Honorable Speaker, several interventions are being undertaken through these support mechanisms, including but not limited to providing technical and financial support for turnaround plans in water and electricity distribution.
But not
Thank you, Honorable Speaker. Providing technical and financial
Honorable
support
Chavane, can you please mute?
in water.
Thank you, Deputy President. Honorable Nduli, your supplementary question.
Thank you very much, Madam Speaker. Good afternoon to you. Good afternoon to honorable members, and of course, to Comrade Deputy President. No, Comrade Deputy President, thank you very much for a very detailed and comprehensive response to the question. As you know that we have about 60 municipalities in the country which are in a very difficult position, and we're very happy that 10 of those have been taken care of, and there are also further interventions that the government is doing, including the second phase of the launch by the President. But does the Deputy President envisage maybe a turnaround time up to what point, given the fact that we are facing the local government elections next year, and certainly it will be difficult that these municipalities, even if we're without elections next year, must continue to be confronted by the major challenges that they face in the various parts of the country. So essentially, Comrade DP, one would be interested to know what else, if any, in your opinion, has to be done to expedite the turnaround in terms of the impact of the interventions that government is doing. Thank you very much, Madam Speaker.
Thank you, Honorable Deputy President.
Thank you very much, Honorable Ntuli. The municipal support and intervention plans are basically meant to address all struggling municipalities, not only the 10. However, the presidency decided that we must start with those 10, focus on those, but work is going to start on most of the municipalities. Ideally, we would have loved to address these challenges before the local government elections next year, but it obviously may not be possible, but we are starting, and that's why with Operation Vulindlela as well, we look at all the reforms that are necessary at local government level, dealing with issues of professionalism, and basically ensuring that with the second phase of Operation Vulindlela, a lot of attention is going to be given to local government over and above the 10 that we have identified, because you are correct to say from that report, even from the Auditor General's report, it is about 60 municipalities. So we need to reach out to all of them, and as soon as possible. We will try our best to ensure that as we get to local government election, a lot of these are attended to. However, we would make sure that as we get into the new local government municipalities after the elections, that we can quickly reach a situation where there are no dysfunctional municipalities. So in short, Honorable Ntuli, we will address all of them. Thank you very much.
Thank you, Honorable Didi D. Van Rooyen.
Honorable Speaker, Deputy President.
I'm sorry, Honorable Van Rooyen, I skipped Ms. A.M. Van Zyl by mistake. If you can, yes.
Yes, I'm not yet part of GNU.
Thank you, Madam Speaker.
I was about to I was about to say, probably you've just done it. But anyway, I also had to make sure that I mention all the Ds, the D. Thank you very much, Honorable Fanzale.
Thank you, Madam Speaker. We also have right to reserve who joins us, so you can stay that side. Given that nearly 90% of ANC-run municipalities, including those that you've mentioned earlier, Deputy Speaker, receive audit disclaimers or adverse opinions, and many fail to deliver even the most basic services, what specific consequence management mechanisms are in place to ensure that municipal officials, especially those in pilot municipalities under Operation Vulindlela, face accountability for persistent mismanagement, and what role will national government play in enforcing compliance where political will is absent? Thank you.
Thank you, Honorable Deputy President.
Thank you very much, Honorable Speaker. Honorable Fanzale, obviously our intervention will ensure that there are consequences where things are not changing. As I indicated that, for instance, the Presidential Working Group is a very active group that goes to the municipalities, work with them, deal with the issues there, because our long-term objectives is to ensure what we can come up around with this turnaround strategy to ensure that municipalities work efficiently. And where we can see that there are councillors, whether they are mayors or MMCs who are not performing up to standard, there will be consequences, but also with the officials themselves. Because in some of the municipalities, it's not the politicians that are creating problems, it is actually the officials of the municipality. So there will definitely be consequences where we can see that people are obviously transgressing. But the important thing is for us to give support to the municipalities to be able to serve our communities. So it's going to be a very targeted intervention that is very real to ensure that there is indeed a turnaround once we get to those municipalities.
Thank you very much, Deputy President. Honorable D. Van Rooyen.
Thank you once more, Speaker. Deputy President, President Mashatile, Antlantle bentwe ya lona Operation Vulindlela. Ibula tsela difeng. Obane since its inception 5 years ago, our economy hasn't registered any growth. In fact, the last financial year it was worse. We registered 0.6% of growth. There are no jobs. Unemployment is at its highest. Now, what is emphasized in this Operation Vulindlela is more on the role of private sector at the expense of building state capacity to provide services to its people. Maybe libula ditsela for your private sector masters. How are you going to ensure that municipalities are capacitated to provide services without manipulation by private sector that might end up charging exorbitant prices to our poor people? How are you going to ensure that our people are protected from abuse of private sector? Thank you.
Honorable Member. Honorable Deputy President.
Morenaka Van Rooyen, Arebola ditsela tse senyehileng. Operation Vulindlela is to ensure that we create those pathways that will ensure that we can deliver services to our people. The issue of growth, it's a big problem globally. Growth has been subdued globally, not only in the African continent and South Africa, but everywhere else. So I take your point that when there is no economic growth, we will have a big problem in achieving the goals we are setting ourselves. That's why if you look at Operation Vulindlela, it's mainly to ensure that we accelerate structural reforms and ensure that we deal even with a lot of binding constraints that are there to growth, to ensure that our economy can grow, to be able to have enough resources to do the work that we need to do. So yes, without growth, there won't be adequate employment. I agree with you. So we will have to put a lot of efforts on growth. In fact, if you listen to the president yesterday, even the Minister of Finance, is that there is a funding that will be dedicated to infrastructure and economic development in the MTF, basically looking to spending almost 1 trillion rand in the coming few years to ensure that we can propel growth higher. So yes, we will have to pay attention to the issue of growth in order to deal with all these challenges. Thank you very much.
Thank you. Ilunga lihloniphekile umkhaliphi.
Ngiyazibongela Somlomo weParliament. Greetings to the Deputy President. Kwimpendulo yakho, I was listening very carefully when you were responding earlier on.
Yes.
Uthi labo masipala abawu-10 identified through a program Vulindlela. But we have 66 municipalities that are dysfunctional. So therefore, umbuzo wami ukuthi uma ngabe uthi uthatha u-10 out of 66, uzoyiqeda nini ke yonke le process? Because in an actual fact, ba dysfunctional bonke omasipala, let alone there's a report that says it's only 66 dysfunctional. Secondly, kwimpendulo yakho again, ubala ukuthi kune intervention ebizwa nge-presidential intervention kumasipala waseThekwini, which is not part of the 10, which is not part of the 66. So therefore, Deputy President, uyabona ukuthi le intervention ngazi ukuthi ayindawo igida ndawona. We have 66, now identify 10, even nomasipala waseThekwini is part of the intervention. Kubonakala as if this Vulindlela is not going to help us.
Isikhathi sakho sesiphelile.
Imalini ke njengoba uthe uzoshintsha ne-model, how much in South African rands has been committed by national government?
Sesinikeza ithuba.
Awahle speakers,
Cha, isikhathi
this is
siphelile.
very serious.
I'm very much aware it's very serious. Deputy President, can you please answer the question?
Thank you, Honorable Speaker. Honorable Mkhaliphi, I did say when I was answering Honorable Ntuli that yes, the President or the Presidency has identified 10 that we had to start with, but work is going to continue on the rest. So it's not that Sizoma for another 2 years before we attend to the rest. But we thought we should start somewhere. Ikona le 10 esibhekile uthi ngempela masiqale khona. But we will then go to the rest because you are right. If we just focus on the 10 and there's no work on any of the municipalities, then it can take us 10 years to deal with this problem. So the issue of professionalism in local government, accountability, issues of government, all those issues identified by the Auditor General will be attended, particularly by the Interministerial Committee chaired by the Minister of Cocta. They are going to go beyond the 10 that the Presidency identified. Those are obviously our first priorities, but we will go to the rest. Now, yes, the metros were not part of those 10, but the President felt there's a need to focus on the metros as well. That's why we came up with this plan that helps us to immediately focus on all the metros in the country, because we know that the metros are very critical Most of our major economic development, you find them in the metros. The bulk of our population, you find it in the metros, so we are attending to them. But sizoenza sure ukuthi so attend wonke umasipala, not only the 10. Siyabonga.
Sibonge Sekela Mongameli, sesiya embuzweni wesibili olandelayo obuzwe ilunga elihloniphekile umnumzana uRE Roo. Umbuzo lo umayelana nokuthi ngabe sesihambe ibanga elingakanani ikakhulukazi kule nguyazana ebhekelene nokuqoqwa kumbe nokuthi sibhekane nesimo sengculazi ezweni, ikakhulukazi njoba kukhona nje imali ethathiwe yilaba ababesilekelela ikakhulukazi izwe laseMelika, ukuthi ke ngabe umnyango wezezimali lapha ekhaya nabanye mhlambe abazimisele ukuthi basixhase ngabe sihambe safikaphi. Sekela Mongameli.
Mangibonge kakhulu Somlomo. Ngalombuzo obaluleke kakhulu kangaka. Honorable Speaker, let me start by assuring the House that the government is currently taking measures to prevent the negative effects that could result from the withdrawal of the President's emergency plan for AIDS relief, mostly known to us as PEPFAR. A report by UNAIDS and other partners indicate that a funding withdrawal on PEPFAR in South Africa without adequate replacement could lead to a significant increase in HIV-related death and new infections over the next 10 years. The abrupt withdrawal of the funding has resulted already in job losses and a negative impact on the national response to HIV, TB, and STIs. To this effect, the Minister of Science and Technology, Dr. Blade Nzimande, has announced an establishment of a working group on science, technology, and innovation funding to advise him on the implication and impact of this recent withdrawal of funding, particularly on key research and development programs in South Africa. Accordingly, the working group will examine risk mitigating considerations related to external funding, particularly of research and development program in critical areas of the national system and innovation. As I indicated during the human rights commemoration, government through the national and provincial departments of health has a contingency plan to address the gaps resulting from this funding withdrawal to sustain the delivery of health services. The Minister of Health is engaging with the Minister of Finance to discuss the possibility of funding these gaps from our own fiscus. The Department of Health and the National Treasury, working with the provincial departments, are assessing the level of need in relation to the program or programs in each of the 27 priority districts that were supported by PEPFAR. This is with a view of rationalizing and consolidating the implementing partners and integrating some of the programs into the primary health care and district health systems. Based on the analysis of the extent of the impact of the reduced financial support, a team led by the Director General of Health is already in talks with National Treasury to discuss funding options. In addition, the South African National AIDS Council has approached the National Lotteries Commission and the SANEC Private Sector Forum to to garner further funding support. The National Lotteries Commission has submitted a funding application for what they call Close the Gap HIV treatment campaign and End TB campaign, which is being considered by its discretionary emergency funding. Madam Speaker, we are hopeful that all these resource mobilization efforts will yield positive results, as we cannot afford to have service delivery gaps in relation to health programs, particularly those focusing on HIV and TB. We will continue with our efforts to find sufficient resources to sustain these health programs, including engaging other countries, not only to assist in funding, but also looking at affordable drugs from those countries. Those are the interventions we are looking at, and I thank you, Honorable Speaker.
Siyabonga Sekela Mongameli, ilunga elihloniphekile uDupi Leroux.
Thank you, Honourable Speaker. Honourable Deputy President, I hope that you understand that there is grave concern by people living with HIV and with civil society organizations that more than 3 months after the funding from PEPFAR through USAID was abruptly stopped, it appears as if there's been no urgency shown by the South African National AIDS Council, which you chair, neither by the National Department of Health, to find funding and to mitigate the damage of these funding cuts. Could the Deputy Minister please indicate why emergency funding under Section 16 was only applied for from Treasury at the end of April, and when he expects this funding to be dispersed to try to reach the most vulnerable patients? Thank you.
Sekela Mongameli.
Thank you very much, Honorable Speaker. Honorable Leroux, the funding that we receive from PEPFAR constitute only 17% of the funding we receive for our HIV programs. And if you take the Global Fund as well, you could add another 7%. So it's basically about 8 billion rands, if you put it in South African rands. Now, when the funding was cut, we immediately looked at that with the Minister of Health, and we realized that all our programs for HIV, AIDS, and TB, people who are receiving ARVs and so on, that program is fully funded for this current financial year. In fact, you must have heard the minister saying to those affected, please go to our clinics and various places where you receive treatment and drugs, you will be assisted. So yes, we didn't respond immediately, but we had to weigh the situation, what are the implications and so on. But as I said in my main reply, we are moving to ensure that we try to be self-sufficient as a country on these matters. The people who were affected mainly were in the many districts, what we call community health centers and clinics. Yes, it's true, because some of this funding from PEPFAR were used to pay for salaries and so on and so on. And that's where we need to engage with the Minister of Finance. But as far as drugs and medicine and treatment is concerned, those people are covered. So we will engage with the Minister to see if we can really be assisted to continue to employ as many people as possible that were paid through the PEPFAR fund. So that's why we are looking at all these engagements, and I'm confident that we will find a solution. Thank you very much.
Siyabonga Sekela Mongameli, ilunga elihloniphekile R Tagodin.
Assalamu alaikum, good afternoon. Deputy President, considering the government delayed response in anticipating withdrawal of PEP4 funding, how does the presidency justify the risk now posed to thousands of vulnerable South Africans, particularly women and children who depend on those programs? And what accountability measures will be put in place for those apparent failure in foresight and planning? Thank you.
Deputy President.
Thank you, Honorable Speaker. Honorable Takodin, yes, we are concerned about these cuts, and as I said earlier, that we are now looking at resource mobilization from other quarters, our own fiscus, but just to assure you that we're not looking at our own fiscus for the first time. As I said, in fact, funding from our own fiscus on these programs already constitute close to 75% of the budget we spend on HIV and AIDS. It is true, though, that when it comes to the employment of people in the districts and clinics, a lot of the funding that was used to pay for their salaries came from PEFA. And that's where the minister is trying hard now to ensure that we can deal with it. But when it comes to drugs and medicine, the South African government actually carries the bulk of that commitment. And that's why I can say to you here, without fear of contradiction, that people will continue to receive their antiviral drugs and treatment without a problem, but we need to close the gap of employing people, and that's the money we're trying to get from other sources, including additional funding from National Treasury. Thank you very much.
Thank you. Lilunga lehloniphekile uNLS Nkwangwa.
Kwangwa, Speaker, Kwangwa. Deputy
Uxolo,
President.
Nkwangwa.
Kwangwa, yes, thank you so much. Deputy President, Section 10.1.6 of the Forum on China-Africa Cooperation, the Beijing Action Plan for 2025 to 2027, China makes a commitment that they will share clinical and disease prevention and control skills and technologies with African countries. But more importantly, they also cite the fact that they would support key projects to support African countries fight against HIV, AIDS, and make resources available in this regard. Now, given the withdrawal of funding by the US, have we as a country considered looking for resources or mobilizing resources from elsewhere in the world, looking at the East, and also looking at other funding that might possibly be available from the EU to try and plug the shortfall that we're experiencing currently?
Sekela Mongameli.
Thank you very much, Honorable Speaker. Thank you, Honorable Kwankwa. Indeed, that's what we're doing. One of the things I should indicate, though, is that drugs that are manufactured in different countries are different. So it's important that before we can say we're going to get drugs from this or that country, we must ensure that we get the right drugs. But definitely we will engage China. I think the minister has already started. Some of our ministers have been there recently. So we will talk to other countries in Europe, in the East, and see where we can get assistance on particularly affordable drugs. We may not get funding per se from other countries, but if we can buy drugs that are cheaper, we can do so. But also with the research that Minister Dr. Blaine Zimande is dealing with, is to look at whether we can produce some of the drugs ourselves. That's why it's important we must put a lot of efforts on the research so that we don't continue to rely on other countries all the time. Thank you very much, Honorable Kwankwa. Thank you, Honorable Speaker.
Siyabonga Sekela Mongameli, ilungu elihloniphekile umfundisi KRJ Mishwe.
Thank you, Speaker. The ACDP is grateful for all foreign aid that this country has been receiving over the years from different countries, particularly funding for life-saving, providing treatment and care for those living with HIV/AIDS. While the ACDP regrets the US government's decision to withdraw PEPFAR funding, we nevertheless wish to encourage South Africans to view that decision as a wake-up call on African governments, including South Africa, to scale down on their dependence on foreign aid and start focusing on training, developing, and skilling our people to become more self-reliant. What I want to know, Honorable Deputy President, is whether government has programs that are aimed at training and developing our people to become more self-reliant. If yes, where are such programs running? And if not, why not? Thank you, Speaker.
Siphelile mfundisi. Honorable Deputy President.
Masbonge, Honorable Speaker. Thank you, Honorable Mishwe, for the suggestions. We actually doing exactly that. We were saying that ourselves, is that perhaps the decision by the US administration to cut funding must be something that really propels us to now take urgent efforts to become self-reliant, not only as South Africa, but the continent as a whole. Let's start doing things for ourselves. So I agree with you, Honorable Bishop. What we are doing in terms of training, as you know, that South Africa is blessed with many universities and technicons that are doing training, but we then have set up what we call the Human Resource Development Council, which the President has appointed me to chair. What we do there, we look at requisite skills for the country, where we bring in the private sector, we bring in labor, civil society, and we look at the kind of skills we need in the country, and then we collaborate with universities and technical colleges to ensure they provide those skills as well. And there we also work with the ministers of basic education, higher education, Minister of Science and Technology is part of that. So the Human Resource Development Council is a mechanism to ensure that not only do we identify the skills needed in the country, but ensure that those skills are being produced. And that's why we're working with all these institutions of learning. They are part of these programs. We do visit them and ensure that we are training young people in particular in all these fields, including to be able to do this work without relying from people from other countries. Thank you very much, Honorable Mishwe. Thank you, Honorable Speaker.
Siyabonga Sekela Mongameli. Umbuzo wesithathu ubhekiswe kuwe Sekela Mongameli, uvela kumholi weqembu eliphikisayo okuyilona elokuqala la kulamaqembu aphikisayo. Umbuzo ke uthi, ngabe Sekela Mongameli, esikhundleni sakho sokuba usihlalo wekomiti lezobulungiswa nokuvikeleka nokuphepha ikakhulukazi kuyicabinet, ngabe ukhulumile yini nongqongqoshe wezamaphoyisa mayelana nokuhamba kancane kophenyo ikakhulukazi kulamacansi anyantisa igazi ikakhulu amacala? Cha, angangizwe. Amacala anyantisa igazi ezocansi ikakhulukazi kubantwana abangakwazi ukuzivikela abikwayo kwabezomthetho amaphoyisa ukuthi ngabe ke yikuphi esikubonayo okukhombisa ukuthi ngabe kuyashesha kulolu phenyo nocwaningo ikakhulukazi kulabo ababaliwe kumbe umuntu oqhakambisiwe ngabe ke kuzothatha isikhathi esingakanani ukuthi lolu phenyo lusheshe. Sekela Mongameli.
Mangibonge Somlo. Ngibonge nalombuzo obaluleke kakhulu obuya kumholi we-MK Party. Mangikale ngokuthi, Honorable Speaker, that we strongly condemn all forms of violence against women, children, people with disabilities, and vulnerable members of our society. Indeed, the Minister of Police did report these matters to us so that we consider them. And we are quite concerned about the prevalence of sexual abuse amongst young children in our country. This remains a cause for concern, particularly due to its traumatic and long-term impact on victims and their families. The painful case of allegations of sexual abuse of the 7-year-old child in the area of Matatiele in the Eastern Cape province and other separate cases of sexual assault of minors are currently being investigated by the South African Police Services. According to the reports that we have received from SABS, investigations are still underway on this case in particular to collect additional evidence that may lead to the arrest of the perpetrators of this young minor in Matatiele. We are, however, concerned, as Honorable Klope has said, about the delays in finalizing the investigation, as this perpetuates emotional trauma to victims and their family members. On the 31st of March, the National Commissioner of Police, having had discussion with the minister, appointed what they call the National Intervention Team to deal with this case. This is led by the head of the Family Violence, Child Protection and Sexual Offences Unit. They are going to quickly revisit this Matatiele case. According to SABS, approximately 30 statements have already been taken to date, mainly from the staff of the school in question, medical personnel who examined the victim, the children who were with the victim, but also family members. Madam Speaker, we all have the responsibility to protect our children. We must make sure that we make every effort that our homes and schools are safe havens for our children. Together as government, civil society formation and other stakeholders, including faith-based organizations and also traditional leaders, we need to foster multi-sectoral approaches to put an end to gender-based violence and the scourge of sexual abuse, particularly directed at women and young children. We also urge the Department of Social Development and its agencies to continue to provide necessary support to the affected families. Similarly, our law enforcement agencies have an obligation to speedily finalize investigations that will lead to the successful prosecution of perpetrators. So, Honorable Hlophe, we have ensured that a doctor, I'm told I must say doctor.
Order, honorable members. Deputy President, continue.
Ungasicabanisi ngoba siyezwana nodokotela. I was saying that this message has been conveyed to the South African police services and those who are investigating, that we have to ensure that there are no delays in investigating these matters. SABC in particular needs to capacitate and allocate more resources to forensic science laboratories to ensure speedy analysis of forensic exhibits collected from the victims of sexual abuse, because this is where we often experience delays. Upon the completion of this investigation, the Minister of Police and the National Commissioner will communicate the findings to the public. We must ensure that justice is served. Thank you, Honorable Speaker. Thank you, Honorable Dr. Hlophe.
Siyabonga sicela Mongameli. Umbuzo wesichibiyelo uzovela kulunga elihloniphekile udokotela uHlophe. Ngicishe ngathi udokotela uJudge.
Udokotela uJudge.
Thank you very much, Madam Speaker. Madam Speaker, I beg leave to remain seated. Thank you very much, Deputy President, for your detailed response. Here is a follow-up question. You will recall that the Minister of Police indicated that DNA samples of the headmaster of the school where Cwecwe was violated in the Eastern Cape had in fact been taken. At the time when he made this announcement, we all know that that had not taken place. Therefore, this was a blatant lie. In the light thereof, when is the Minister of Police going to be fired? If not, why not? Furthermore, what disciplinary steps will be taken against the police officer who failed to timeously secure a DNA sample from the headmaster by invoking Section 36(e) of the Criminal Procedure Act 51 of 1977 as amended? Thank you.
Sekela Mongameli.
Mangbong Somlom. Thank you very much, Dr. Hlophe, your follow-up. I did say earlier, Dokotela, that on the 31st of March, the police commissioner appointed a national intervention team led by the head of the Family Violence, Child Protection and Sexual Offences Unit. Now, this is to ensure that we immediately revisit the case. I'm sure some of the issues you are raising, Sizozithola kule investigation. And this report will obviously go to the president, who then will see who did not do their work and what happened. So I can't confirm whether there's somebody who actually lied. Let's allow this investigation to go and take place, and then we will decide. I think what is important for me is that really we must ensure that the victims and their families really find closure, they know the truth, and they can see that we are doing something. But I'm happy that you've raised this question so that we must really focus on it. We're not going to run away and say, no, we've done our work, that's it. Let's allow this unit now to do its work. Masbongeke Dokotela. Thank you, Honorable Speaker.
Isichibiyelo sombuzo wesibili sivela kulunga elihloniphekile uWT Plaatjes.
Thank you, Honorable Speaker. Honorable Deputy President, we welcome your point on the subsuit, that subsuit capacitate its forensic services ensure speedy resolutions to crime in general and sexual offenses in particular. But as you are raising the issue, Deputy President, that I would like to ask you that you assure, in addition of solving the case, that there is a focus on the victim itself in terms of providing necessary support and assessment and rehabilitation, especially that the victim is a minor. So that will be a request, President, that you follow it up and ensure that that happened. I thank you, Speaker.
Thank you. Sakela Mongameli.
Thank you very much, Honorable Speaker. Honorable Plakis, one of the things that we always want the SAPS to do is to ensure victim support. So in addition to the work that they do to fight crime and prevent crime and do investigations, victim support remains very important. Particularly when you deal with minors, it becomes even more important. In some of the police stations, as I speak, we have gender-based violence desks. They also have what they call special rooms where victims of gender-based violence can report their cases and be dealt with in a friendly manner. They call them victim-friendly rooms. So this is a very important